Hey guys, welcome to a day in my life, a work vlog, work life vlog, I don't know. But I'm at the hospital now meeting with the patients who delivered, and then I have to go back and write my notes.
Sixth floor, going down.
Just saw my second patient. I'm heading back to my office now to complete my notes, make a chosen division report, and see my
Fourth floor.
So I had a patient deliver yesterday, I had a patient deliver today, then I still have patients coming in. The weather is pretty bad, we kind of have like a tornado watch, so I'm not sure if a lot of patients will actually show, but we'll see.
Ground.
You have reached Center for Life Solutions. If this is a true medical emergency, please hang up and call 911. If you are calling to make an appointment, please dial...
One eternity later.
You have reached Erica at Center for Life Solutions. If you are calling to report clinic missing,
12 seconds later.
a clinic message and the reason you are missing. Thank you.
Hi, my name is AuJunae. I'm a social worker at the hospital. I did want to let you guys know that we do have a patient here who is getting methadone from you guys last name, and she delivered her methadone from us today and tomorrow probably, moving forward until she's discharged. I suspect that she might be discharged possibly on Friday or tomorrow, so she will for sure get a methadone from us, so that's the reason why she has not received her dose in the last few days, so she might have missed also on the so that's also another reason why it's due to labor and delivery. Thanks. Lunchtime. So I just finished lunch. I am done with my chosen division report. I talked with the worker. I need to follow up with the worker from yesterday's supervisor because she's out on vacation. And I think I'm caught up on my notes. I think I have to do one note, like prep it for when the patient gets here so I can just like fill in the blanks. But yeah, pretty chill day. Busy day, but chill. Not chaotic, which is nice.
Tomorrow.
Hey y'all, happy Friday. I'm gonna post this on a Friday so you can see it on a Friday. But I am at work. I just got here not too long ago, put my things up as you saw, and I have a new delivery. And then I still have 2 moms and 2 babies at the hospital as well that I need to go check in on. I need to follow up with Children's Division. And the new mom that delivered today, she's actually been in sobriety throughout the entire pregnancy and a little bit before that. So I don't even need to make a call to Children's Division. So super excited about that because that's one less thing to worry about and do. I just need to double check to make sure that's accurate because she did test positive for benzos, but she has been getting a script from a psychiatrist for Adderall and Vyvanse, I think. So it should be a pretty relatively good Friday. Easy. I'm gonna also try to bring up some clothes to donate to our moms so they can like pick through whenever they want. But yeah, let's get this Friday started, okay? Okay, so I'm clocking, well, not clocking in. I'm checking our Epic system now because I did check at home before I came to work just to make sure that I had to come to work because I can work from home on Fridays. But with no deliveries,
so
once
it took some
Friday.
finagling, but my sister has got her kids out of the house because she was
Okay, I'm on my way to the hospital now to go visit with my mom and check in to see if there's any updates.
Now, yeah, for now, traveling beneath the ground.
Okay, so I left my first patient room. She's the one that just delivered this morning, had a C-section. So saw her, the baby's doing well, she's doing okay. So now I'm gonna see my other 2 postpartum moms. Back in the elevator, don't you guys love the elevator? But I saw all of my moms, everybody's doing well. No one had any serious questions, comments, or concerns. I did tell them that I will be following up with their Children's Division worker to get an update, to discuss discharge, and let them know so they're not waiting. But I'm gonna tell you guys today. So I'm gonna explain to you guys what it is that I talk to my moms about when I go visit them in the hospital. I think that some of that is important information that I've never really shared before, is like what happens once my moms actually deliver and what the steps or that process kind of looks like. So I'm gonna do a brief explanation in this video, but if you guys want, please comment down below and let me know if you want a completely separate video going into more detail and depth of what that kind of visit looks like. So just let me know and I'll be sure to film that for you guys. Hey guys, I'm in a patient room. I overfilled my water bottle, but I thought this might be a good time to chat with you and kind of tell you what goes on. So I thought I'd talk to you guys today about the process of kind of what happens briefly when I go to the hospital and my patient's delivered or they're like recently postpartum in the antepartum section of the hospital. And I can make a full video just like going more in depth about that. But so when my patients go over to the hospital to deliver a baby, I will typically go meet them in their room, and I will just like ask them basic questions like, how are you? How's your care been? Do you feel like you need anything? Do you feel like you've been taken good care of? Feel like you've been heard? Have you been able to advocate for yourself on the things that you feel like you need? So like I just ask them basic questions because they're about to deliver, so I want to make sure that they are aware that like moving forward, like things are going to change. If your baby were to go into the NICU, here's kind of like what happens once your baby goes into the NICU, because mom and baby are then separated. So it causes them a little bit of anxiety, a little bit of stress if they're going to be separated from the baby, if their baby goes to the NICU for any reason. So I just go over like just basic questions, just comfort questions, seeing if they have everything, see if they have any questions regarding children's division, if children's division is going to be referred. I let them know like once you deliver, a children's division worker will come back to will come by the hospital to come visit you, to see the baby, to check in, to see if there's anything you need. And they'll follow up with me and I'll follow up with them, and then one of us will get back to you. But if you have any questions in the meantime, you can always feel free to give me a call. So that's what I typically tell them if children's division is going to be involved. If children's division is not going to be involved, and I tell them like once you and baby are medically ready and cleared by the doctor, you guys are good to go home, everything should work out. If you have any questions, comments, or concerns, feel free to reach out to my clinic for me personally, and I'll do my best to assist you and help you out with that. So those are kind of things that I just briefly go over. Sometimes if the patient's new to our clinic and I haven't had a chance to meet them really or do their consult or assessment, then that's the time where I would do that. Sometimes I go to the hospital and I help them get into treatment. And then I also like follow up with the nurse and or the residents or charge nurse, whoever I can get a hold of. I hope that you guys enjoyed the video today, just me showing you a quick glimpse into what a busy-ish Friday looks like, because we don't necessarily see patients in our clinic. But as you saw, I had 3 patients in the hospital and then 3 babies in the hospital as well. So there's just a lot of follow-up to do as far as that side of my job goes, is dealing with a lot with the hospital on Fridays and making like follow-up calls to patients and preparing for Monday. So yeah, that pretty much concludes this video. I hope that you guys enjoyed. If you guys want more information about anything, please comment them down below. If you want a specific video of me going more in depth about the process that I use or do when I go meet my moms at the hospital, then feel free to let me know that you want to see a video about that, so I can be a little bit more descriptive about what an OBGYN hospital, maternal fetal unit social worker does. And yeah, I hope you guys are doing well, and I'll see you in the next video. Bye.